Hepatitis B is an gastrointestinal infectious disease. Viral disease. Look at this picture. Hepatitis B in liver. Look at this. And hepatitis B virus. A detail going on. Introduction. Hepatitis B is a viral infection that affects the liver and can cause both acute and chronic diseases. It is a major global health concern with millions of people infected worldwide. The disease is caused by the hepatitis B virus, which primarily spreads through contact with infected bodily fluids. Early detection and appropriate management are crucial in preventing complications. A definition: hepatitis B is an infectious disease caused by the hepatitis B virus HBV that leads to liver inflammation which can progresses to severe complications such as liver cirrhosis, liver failure, and hepatocellular carcinoma, liver cancer. Etymology: the term hepatitis B comes from the Greek hyper, meaning liver, and the suffix itis, meaning inflammation, referring to liver inflammation caused by the virus. The letter B distinguishes it from other types of viral hepatitis, with its classification emerging in the 1960s after the discovery of the hepatitis B virus HBV. Types: 1. Acute hepatitis B, a short-term illness that occurs within 6 months of exposure to the virus. The immune system may clear the virus naturally. 2. Chronic hepatitis B, a long-term infection lasting more than 6 months, which can lead to serious liver diseases over time. Causes: hepatitis B is caused by the hepatitis B virus HBV, which is transmitted through 1. Unprotected sexual contact with an infected person, 2. Sharing needles or syringes, 3. Mother to child transmission during childbirth. 5. Blood transfusion with contaminated blood. 6. Sharing personal items like razors or toothbrushes with an infected person. Risk factors. 1. Unprotected sexual intercourse with multiple partners. 2. Healthcare workers exposed to infected blood. 3. Intravenous drugs users. 4. Individuals undergoing dialysis. 5. Infants born to HBV infected mothers. 6. People with weakened immune system. Example, HIV positive individuals. Complications. 1. Chronic liver disease. 2. Liver cirrhosis. 3. Liver failure. 4. Hepatocellular carcinoma, liver cancer. 5. Kidney disease. 6. Blood vessel inflammation. Pathophysiology. Once the HBV enters the bloodstream, it is reach the liver where it infects hepatocytes liver cells. The virus replicates within the cells and triggers an immune response leading to liver inflammation and damage. Chronic inflammation may result in fibrosis, cirrhosis, and liver cancer. Pathophysiology of hepatitis B step by step process. 1. Viral entry and infection. Hepatitis B enters the body via blood, sexual contact, or prenatal transmission. The virus reaches the liver and binds to hepatocytes using the sodium tarocolate co-transporting polypeptide (NTCP) receptor. HBV is the internalized to the hepatocytes. 2. Viral replication in hepatocytes. Once inside, HBV releases its partially double stranded DNA into the nucleus. The rcDNA is converted into covalently closed circular DNA, which serves as a template for viral replication. HBV uses host cellular machinery to transcribe viral mRNA, which is then translated into viral proteins. Viral replication occurs via reverse transcription, forming a new HBV DNA, which is packed into viral particles and released into the bloodstream. Three, immune response and liver damage. The innate immune system detects HBV but does not mount a strong early response, allowing the virus to persist. The adaptive immune response, T cells and B cells, is triggered, leading to an attack on infected hepatocytes. Cytotoxic T cells destroy infected liver cells, causing hepatocyte damage and inflammation. 4. Acute versus chronic infection. In acute hepatitis B, a strong immune response clears the virus within 6 months and the patient develops immunity. In chronic hepatitis B, the immune response is weak or ineffective, leading to persistent HBV infection and continuous liver damage. Chronic infection increases the risk of fibrosis, cirrhosis, and hepatocellular carcinoma (HCC). 5. Long-term complications. Persistent liver inflammation leading to fibrosis, scar tissue formation. Extensive fibrosis progresses to cirrhosis, causing liver dysfunction. Chronic HBV infection increases the risk of hepatocellular carcinoma, liver cancer, due to continuous hepatocyte destruction and regeneration. Signs and symptoms. 1. Fatigue. 2. Jaundice. 3. Dark urine. 4. Clay colored stools. 5. Nausea and vomiting. 6. Abdominal pain. 7. Loss of appetite. 8. Fever. 9. Joint pain. A diagnosis. Medical diagnosis. 1. Blood test. Detection of hepatitis B. Surface antigen. Hepatitis B core antigen and liver function test. 2. polymerase chain reaction PCR test determines the viral load. 3. Liver ultrasound access liver damage. 4. Liver biopsy evaluate liver inflammation and fibrosis. Nursing diagnosis. 1. Risk for infection transmission related to presence of HBV. 2. Fatigue related to liver dysfunction. 3. Altered nutrition less than body requirements related to loss of appetite. 4. Risk for impaired skin integrity related to jaundice and pruritus. 5. Anxiety related to disease prognosis and potential complications. Disease management. First, medical management. 1. Antiviral therapy. Tenofovir, Endisavir or lamivudine. 2. Suppress HBV replication. 2. Interferon therapy. Boost the immune system to fight the virus. 3. Liver transplant. In case of liver failure or severe cirrhosis. Nursing management. 1. Monitor vital signs and liver function test. 2. Provide proper hydration and nutrition. 3. Educate the patient about the disease, transmission, prevention and adherence to medication. 4. Encourage rest to manage fatigue. 5. Administer prescribed antiviral drugs as needed. Treatment options. 1. Supportive care, adequate hydration, rest and symptom management. 2. Antiviral medications reducing viral replication. 3. Liver transplant for severe cases with liver failure. 4. Interferon therapy stimulates the immune system. 5. Regular monitoring to assess disease progression and prevent complications. Psychosocial medicine. 1. Patient education, providing information on disease progression, treatment, adherence and prevention. 2. Counseling and support groups, emotional support to reduce anxiety and depression. 3. Social support, engaging family and communities in care. 4. Employment and financial guidance, helping patients with work accommodations and financial support. 5. Behavioral interventions, encouraging lifestyle modifications such as avoiding alcohol and smoking Prevention measures. 1. Hepatitis B vaccination, the most effective method of prevention. 2. Safe sex practices, using condoms to prevent sexual transmission. 3. Avoid sharing needles and personal hygiene items. 4. Screening of blood products, ensuring safe blood transfusion. 5. Maternal screening and immunization to prevent mother to child transmission. In conclusion, hepatitis B is a serious infectious disease that requires early diagnosis and appropriate management to prevent complications. Vaccination, safe practices, and public awareness are key to reducing the prevalence of HBV. With proper medical care, individuals with hepatitis B can lead healthy lives while minimizing disease progression. Thank you. Have a nice day.